Okay, Dr. Jenny here, our next video for fourth trimester, again, continuing with some mobility here. We really just want to work on getting some good blood flow through our pelvis and our mid-back, especially shoulders, because we are working those a lot. So we're going to start today in our child's pose position. We're sitting back and down. I want wider knees than normal, so knees kind of on the outside of that mat if you have one. Big toes touch, and we're going to rock forward and through. Good. And then coming back. Good. Forward and through. And then coming back. Good. Forward and through. And then coming back. Good. Just rocking those hips. There we go. Okay, from here we're going to plant our feet, our toes, push those hips up for a down dog. And we're going to step our left foot outside that left hand, lower it down, some shoulder sweeps. We're coming back and around, head follows your shoulder, around, and one more. Back and around. Good. Planting that there, stepping back, and then switching sides. Stepping up and through. Good. Push that knee out a bit, and then our shoulder sweeps. Our upper backs, mid backs, take a great beating when we have littles. And 3. Good. And you can by all means do more if that feels good for you. Going into thoracic rotations. So all fours, hand comes behind my ear. We're going to rotate down. Nice exhale up. Rotate down. Nice exhale up. Rotate down so my elbow hits that opposite forearm. And rotate up. Switching sides. Down, rotate up. Down, rotate up. Down, and rotate up. Good. Now flipping onto our booties. Doing a little bit of hip rotations. I call this windshield wipers, but basically I want my heels outside of my butt. And we're going to rotate side to side. Nice and slow. Just getting a little bit of movement in those hips. Rotation, because the other ones we've done so far are more flexion extension, which is great, but we live a lot of our lives in flexion. So we really want to work on that rotation piece, because our rotation piece, especially for your pelvic floor healing, is super important. And that's the thing that a lot of us miss. Okay, so a little bit of core activation. We're going to lay on our backs, knees above our hips, okay? And we're just going to do heel drops. So you're standing here, nice exhale, heel drop, and back up. Heel drop, and back up. We should feel, as you work on this, it might not happen right away. You should start to feel your core there, right in the middle, belly button to pubic bone, starting to engage a bit, especially if we pair it with our breath. So you want to exhale down and up. Exhale down and up. Exhale down and up. So pulling that belly button, engaging those muscles, not sucking it in, engaging those muscles to pull that belly button in. And I want to try to keep that contraction on the lower and the upper. If you're having a tough time with that, exhale down, inhale quick, re-engage for that exhale up, or start with your feet on the mat and just do a knee drive up and then back down. However you need to do that. But slowly but surely as you work on this exercise, you start to feel those ab muscles engage. We're really focusing on our abs a little bit more than our back, because our back is already really tight because we were pregnant. And so everything gets pulled forward. So that's where the pelvic rocks and the down dogs and some of those exercises, we're trying to lengthen out those back muscles so that our ab muscles can start to work again, and then to get a better actual true 360 core engagement.